Hi, my name is Alyssa Oliver, and today I will be giving a presentation on how to give CPR. Performing CPR properly can mean the difference between life and death. CPR, which stands for cardiopulmonary resuscitation, is an emergency procedure done when someone's breathing or heartbeat has stopped. CPR techniques vary depending on the age or size of the patient. Step 1. Survey the area. Although you want to begin doing CPR as quickly as possible, you must first survey the area. The person who is to perform CPR needs to ensure that he or she will be safe while performing the procedure. They may want to look for traffic, fires, or other potential dangers. Step 2. Determine if CPR is necessary. Ask loudly if the person who looks to be in trouble is okay, or even gently shake the person to check for responsiveness. Listen, look, and feel for breathing. CPR is necessary only when a person is not breathing or circulating blood adequately. Step 3. Call 911. If two people are present, one can begin CPR immediately while the other calls 911 for help. However, if only one person is present, that person should call 911 before beginning CPR. Step 4. Position the unresponsive person appropriately. Place the person on his or her back on a firm surface such as the ground. Open his or her airway by lifting the chin and tilting the head upwards. While doing this, you need to be looking for signs of breathing. Step 5. Begin rescue breathing or mouth-to-mouth. Giving mouth-to-mouth to an adult is much different than doing so to a child. For adults, mouth-to-mouth is done simply by pinching the nostrils together and giving 2 breaths into the mouth. For children or someone with mouth injuries, it is much easier to use rescue breathing. This gives breath to the nose and the mouth at the same time, but this should only be done by someone who is professionally trained. Step 6. Begin chest compressions. This should be done only when a person is unconscious and does not have normal breathing. Once you determine whether the patient is an adult or a child, you may then start chest compressions. An adult chest compression would need to be a person performing the CPR would place the heel of his or her dominant hand between and slightly below the victim's nipple and place the other hand on top of that hand, and then position the shoulders directly above the hands and keep the arms straight, using your body weight to push 2 inches deep, going at 100 compressions per minute. However, a child would need a much different set of chest compressions. This should only use one hand to compress the chest about 1/3 to half of the depth of the chest. And for infants, only 2 fingers should be used, and the same steps follow. After approximately 30 compressions, give 2 rescue breaths. Then return to perform 30 additional chest compressions and repeat as needed. Step 7. Administer a shock. Administering a shock to an adult or child patients using an automatic external defibrillator is if possible. After administering 1 shock, resume chest compressions for 2 more minutes before administering another shock. Step 8. Continue to give CPR and be able to provide information to an emergency professional. If you are continuing to give CPR until an emergency personnel arrives or until the victim regains consciousness or movement, then you are then able to provide information to the appropriate healthcare professionals. Explain how the victim was found and how long the CPR was performed, as well as any other information that may be relevant to the treatment. At this point, I would like to conclude my presentation on how to give CPR. Always remember to look, call, and perform. If you are interested in becoming registered for CPR, I would suggest taking a class near you so that you can be available if someone needs you to perform randomly. I hope that this presentation has helped you by being able to help others when they need you most. Thank you.